Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Today is Tuesday, June 7, 2022, and thank you so much for joining. As always, for 2.5 years, we've been here answering your questions directly about COVID and other public health issues. Just so folks know, we are planning to continue on an approximately weekly basis these updates, even while a lot of them are unlikely to be fully COVID focused. I know and have really appreciated how many of you have continued to tune in and asked really thoughtful, helpful questions as we think about the health of Chicago. So again, thanks for tuning in and thanks for your interest. You'll be able to put your questions directly into the box below or use the hashtag AskDrArwady on either Facebook or Twitter. We will, as always, I've got some, we'll take a look at the dashboard. We'll go through a number of slides and updates that are responding to questions that have come in, and then we'll take your live questions at the end. So as always, we'll start with our dashboard, chi.gov/COVID-. I want to highlight that our digital team pulled some data to look at what recent uptake has been. There's actually more Chicagoans or more people who are looking at this data dashboard in 2022 than did in 2020 or 2021, which is interesting. For those of you who want to explore even more data, I refer you to the Chicago Health Atlas at chicagohealthatlas.org. We've migrated some COVID data there, but you can do a lot of matching with other diseases. You can look at a lot of the socio-demographics, and it's a partnership with the UIC School of Public Health in Metopia. So anyway, just encourage you, and I'm glad so many of you continue to look at the data. So if we take a look here, you can see in terms of cases, we're averaging 915 cases per day, which again is down a bit. So I'm pleased to see that. You can see on the graph here that really over the last couple of weeks, we've continued to see a slight decrease in reported cases. Now we know there are lots more cases that are not formally reported, given that the patterns of at-home testing are really quite high, and we're very supportive of at-home testing. We have lots of ways to monitor the outbreak besides just cases, but nevertheless, we consistently are seeing this here, and I'll show you in a minute, around us as well, that it does look like the decline is coming. I want to highlight that as of Friday, with Chicago Public Schools wrapping up the school year, June 10th, I believe, is going to be their last day of their screening testing. And so I do expect that over the next week or two, we'll probably see some even further decrease in cases and probably a little bit of increase in that positivity, simply because we have a lot of testing that doesn't come in through schools. So don't be surprised by that, and rest assured that we continue to know things are coming and monitor behind the scenes. Hospitalizations also flattening off. We're 29 a day compared to 32 a day from a week ago. Remains very low, as you can see, compared to prior parts of the outbreak. Deaths also since March have been the lowest that they've been throughout COVID, and we're still averaging just 0 to 1 deaths a day, maybe 4 to 5 a week. Still, I would like that to be entirely zero, but the lowest it's been since the beginning of COVID. Doing about 2,000 vaccines a day. We're getting close to that 5 million mark in Chicago, so we'll be watching for that. And about 18,000 formal tests every day across Chicago with a positivity of 6%. Just as a reminder, right up here, cases by zip, tests, vaccines by zip. This gets updated every day, and you can click through and explore for your neighborhood or any point in the pandemic. You can also download that data. And then up at the top here under latest data is where you can find what's happening with our community COVID levels, our hospital capacity every day, vaccine effectiveness, coverage, variants, wastewater, life expectancy, et cetera, et cetera. So encourage you, where you've got additional questions, to continue to explore that and give us feedback if there's other things that you're interested in. So I'm going to move to some slides, and I'm actually going to start with a few of the updates that are not COVID related, because there's been a lot in the news here. Okay. So first of all, the Community Safety Coordination Center, which some of you may remember is really an effort of the city of Chicago to take some of the lessons that we learned during COVID, and especially coordination. We created a vaccine operations center at the city that for the first probably 6 months or so of vaccine outreach was staffed by people from across city departments, also really a home base for a lot of community partners, and major focus on coordination, equity, data, et cetera. And we've worked to replicate that with the Community Safety Coordination Center, and pulled, really recognizing that there's a lot of community leaders in this space. There is funding that comes from the city, but also from the county and the state, and we want to be as consistent and organized as we can where we're working on violence prevention and intervention. So June is Gun Violence Awareness Month, and so I know as Americans, as Chicagoans, we are all very aware, of course, of gun violence, but we also want to use this month to highlight some of the indirect ways that gun violence in particular impacts Chicagoans. And so one of the things that's up for the month is this ripple effect trail on the right here. A bullet can travel up to 1.5 miles. And so there are 3 1.5 mile walkways that have been set up, one on the south side, one on the west side, one on the north side, and primarily in parks. But you can listen to a 37-minute audio companion along the way that includes a lot of Chicagoans talking about gun violence. I'm not sure which of my words they used, but I did contribute as they were pulling this together. And certainly we think a lot about gun violence as a public health issue, not just in terms of response, but in terms of a lot of the prevention work. And under Mayor Lightfoot, we've got major new investments. So anyway, I encourage you, if you get a chance at some point this month, to go check out one of those trails. I think they're just up for the month with awareness. And then the ripple effect is the term that we're using, that, it's not just the person who gets shot. It's that family, but also that neighborhood, and really all of us here in Chicago, and really wanting to take that broader view. So these are CDPH staff members who were wearing orange last Friday for Gun Violence Awareness Month. So you don't always get to see pictures of my staff, but these are folks on the left at our main campus, and then at some of our other centers. So you see a lot of orange there, and we are pleased that there have been a lot of investments, new investments in thinking about gun violence prevention and what can we do beyond the important role that the police and the public safety colleagues play. I also wanted to highlight that out of the Community Safety Coordination Center, just yesterday, they announced the details of this Home and Business Protection Program. So if you live in Chicago, if you operate a business in Chicago, if you own a vehicle in Chicago, you can actually get reimbursed if you want to upgrade, add outdoor security cameras, outdoor motion sensor lighting, or vehicle GPS trackers with the concern around carjacking. And so all of these, of course, allow for better investigation. So this is not a Chicago Department of Public Health initiative. This is out of community safety. But I did want to highlight that you can get reimbursed up to $225 per camera for a maximum of 2 cameras, and they'll pay for subscription costs if needed for up to a year. Similarly, you see here up to $100 for the outdoor lighting, and then up to $50 for GPS tracking devices. And to get reimbursed, you go to chi.gov/HBPP for Home and Business Protection Program. You'll have to give your proof of address, your proof of purchase, and show that it's been installed. And it's only eligible for devices that were purchased as of yesterday and moving forward. You're encouraged to register those with the Chicago Police Department. Not that they're monitoring all the time or anything, but if there's a crime, then they know where there might be a camera, a tracker, et cetera. But you are not required at all to register that. So if that's something that you're interested in, please reach out. And the city is working with community partners, block clubs, et cetera, to make sure that there are more of these devices, especially on the lighting side in select communities. All right, I also wanted to show you a video from Chicago's CARE team. We've had folks on from the CARE team because this is something the health department is directly involved with. This is the Crisis Assistance Response and Engagement Program, where for the very first time we're embedding 911. We're embedding mental health professionals in the 911 response system. So I wanted to there's a short, I think 3 to 4 minute video that I'd like to just show so you can see the update there. Can we turn that?
Chicago emergency. If we have a person, he's mentally disabled though, and they usually ask us to have the care team come out to escort him out.
There's a mental health crisis in the U.S. and here in Chicago. But the mayor is making a historic change. This is the care team. It's short for Crisis Assistance, Response, and Engagement. It's the city's first ever pilot program that integrates mental health professionals into our 911 response system. The team is made up of a mental health professional, a paramedic, and a crisis-trained officer.
We don't get very much information ahead of time. Usually the police officer gets out to secure safety, if there's no other officers there already. And then the paramedic and I come and we do our thing.
Jennifer Garros is always ready. She's a team member and a mental health crisis clinician. She lived in Dallas for 2 decades, and during her time there, she gained experience working in a similar program.
I've seen it work. I feel like it's something that Chicago needs, and I want to be part of bringing that to the citizens here in the city.
Jennifer and her colleagues provide professional mental health assistance and de-escalate situations.
I'm going to also try to work with the hospital on the back end because I need to know what happens next.
They also link individuals to community care or mental health agencies that can provide long-term support.
This team is trying to get more appropriate care or the right kind of care to individuals having crises.
CARE was created thanks to the recommendation from community partners in 2019. Multiple models are currently being tested, and the results show there's a future for 2 versions. One group pairs a paramedic and a mental health professional. The other includes Luke's team.
Sometimes the client themselves connect better with the paramedic, or for example, I'm actually from the north side. I typically work on the south side. My police officer is much more familiar, and so there are people that we encounter who already know them, right? And so when we step out of the car, they want to talk to them first. So it's knowing when to step back and let people take the lead, and then also when to transition when that becomes appropriate.
We have lots of different types of mental health calls that we get in the 911 system, and we're trying to incorporate healthcare professionals across the entire continuum so that really regardless of the specifics of the call, you are going to be met by a mental health professional if you call 911.
Matt Richards is a Deputy Commissioner of Mental Health at CDPH and heads CARE.
If you look at behavioral health crises, they're the only type of healthcare event where we do not primarily send healthcare professionals to respond when you experience a crisis. Any other type of healthcare event that you have in any city in America, the primary people that are going to be sent are going to be paramedics. But when it comes to mental health and substance use related crises, which are also part of our health, we historically have only sent police officers. And so you have a mismatch between what the person really needs and the type of response that you normally get. That often leads to poor outcomes for the patient.
From a police perspective, working with a team that has a different set of tools and expertise, down the road it's going to make it easier to go to these types of calls. We're looking for another answer to deal with mental health.
CARE works in Auburn Gresham, Chatham, and on the north side in Lakeview and Uptown, communities that have the highest volume of 911 calls related to mental health. Having a police officer on board allows the team to respond to calls of varying risks, enabling them to reach even more individuals in crisis.
We've gone to a couple scenarios where, you thought it was going to end in a tussle or a fight, and we were able to talk them into willingly going to the hospital and, figuring out some resources for long-term for himself.
The mayor's budget allocated $15 million for the CARE team in 2022, and its future looks bright as the city looks to make CARE a permanent part of the 911 response system.
In its beginning stages, we're having some success, I would say so.
For Inside Chicago, I'm Cesar Rodriguez.
All right, great. So I hope you like that. It's a program we're really proud of, and just recently launched the version that only includes a paramedic and a mental health professional. And it's just, I think it's good, where we treat these health crises first and foremost as the health crises that there are. All right, we got a number of questions over this last week or so about monkeypox, so I wanted to just touch on it very lightly. So we have had 2 cases here in Chicago, nothing unexpected there, not seeing anything of major concern. Obviously, anytime there's a virus that is behaving a little bit unusually in a family like orthopox, we obviously want to pay close attention, and we are. But I want you to know monkeypox is spread through close contact, like touching someone's rash or sores, or sharing bedding, or respiratory droplets, like from kissing, coughing, sneezing. It is not airborne. And really, people do get these rash or unusual sores. You can get them wherever, and I put some pictures on the right because people were saying they wanted to see pictures. But these are not rashes that you generally would miss. And really, if you get a rash or you've got a close partner who might have an unusual rash, I would hope that regardless of whether you knew that monkeypox was of some concern, you would seek a doctor, and that's what we want you to do. And you should avoid close contact, like touching the sores or kissing or having sex with anyone who has that rash. So there's more information on chai.gov/monkeypox, but not a point of major concern at the moment, and we continue to monitor. Also, a lot of questions about what's happening with COVID shots for the little ones, the kids under 5. So I'm happy to tell you that it does look like things are moving more than they had in the past. So there were announcements that it's possible we could be ready to go as soon as June 21, just a couple of weeks from today. We will be ready regardless. So as a reminder, here's kind of what's happening. There's an outside panel of experts advising the FDA that is meeting to discuss this on June 15, so in 8 days. And if the FDA grants emergency authorization to one or both vaccines, Moderna and or Pfizer, then the CDC expert panel would convene and make recommendations. And if that all moved quickly, it's possible that they could be ready to ship vaccine as soon as the 3-day weekend that includes Juneteenth. And so it's possible we could be ready as soon as June 21 to be vaccinating children under 5. Already, obviously, this is dependent on the authorization and the approval from the FDA and CDC. But right now, we have been surveying pediatricians and other pediatric providers in Chicago. We've been enrolling right now the settings that want to be able to get vaccine. Reminder that the vaccine for these youngest children is a separate formulation, a very, very low dose. And so it's new vaccine that has to be shipped. Your doctor can't just use the vaccine that they already have. And so we've already done extensive training for our local providers and the Illinois chapter of the American Academy of Pediatrics. We funded them to host provider webinars, for the doctors and nurses and teams on both June 9 and 15, just to make sure everybody is prepped for rollout. We do expect most of these youngest children to be vaccinated through their pediatrician, not so much through pharmacies, for example. We will be planning to include vaccine for children under 5 in our at-home, our Protect Chicago at-home program. We also will likely stand up some larger sites in the short term. And we have about 169,000 children under the age of 5 that live in Chicago. And based on our population, we expect that we'll get somewhere around 15,500 doses of Pfizer across the whole city that first week, and or 15,500 doses of Moderna. Just again, we'll see what happens with the authorization, and then additional doses each week after that, depending on uptake. And this is national data, but it's from April. But you can see that when people have been surveyed across the country, about 18% of parents of kids under 5 say, yes, I want to get my child vaccinated right away. The largest group actually is in this wait and see. They want to, let it roll out for a couple of weeks. And then we've got 11% saying only if it was required, and about 27% saying at this point they're definitely not planning to vaccinate their children, which concerns me. But anyway, that's where we are. So we'll be following some of this. But I see this as really exciting that we are doing the actual kind of planning around ordering, because that tells me that there's a lot of confidence. I know the safety data is good, and that suggests the efficacy data is good too. Okay, so on COVID, Just nationally, I saw Ina Miller wrote in saying, do you advise traveling internationally right now? I will tell you that generally, there are still parts of the world, particularly you can see in Europe there, Australia, New Zealand, that are having a lot of COVID. Basically, the darker red or purple, the higher number of cases that are being reported. All over the world, we're not seeing a lot of severe illness, just like we're seeing here in the U.S. So, number one, I would not advise, if you are considering traveling internationally, I would not advise doing that unless everybody traveling is up to date with vaccines, meaning a first booster at least for everybody over the age of 5 and for anybody over 50, a second booster. And I would be, I would be masking in indoor spaces. But I know a lot of people are excited to be getting back to travel. And I think if you're not at significantly higher risk for a severe outcome and you're up to date, it's appropriate, but look at this map and other maps. There's more on our website and the CDC around the places that you're considering going. You can get a better sense. Across the U.S., numbers have actually been coming down a little bit in terms of cases. We're averaging 30 reported diagnosed cases per 100,000 people per day. Illinois, a little above that at 37, and Chicago at 34. I see the question about, should we be reporting at-home tests that are positive? We encourage you to let your doctor know that because, first of all, in case you should get Paxlovid or one of the other medications, if you're at higher risk for a severe outcome, we want you to get that right away. But also, your doctor can report that in. But we don't, from a monitoring of COVID perspective, we don't need to have every single test reported. But please do let your doctor know. Here's what the country looks like. 30% of U.S. counties are either in high or medium COVID level. You can see on the right there, that does include Northeast Illinois at high in orange there. And some of this is cases, and some of it is that there are some more hospitalizations. Again, less in the city of Chicago, and this is where this is available on our website, but our risk level does remain high this week. But you can see that in Chicago, we want to get those cases back down under 200, and we're down to 237. We were quite a bit higher than that previously. And Cook County overall, including the city, is at 270, but also on the way down. And then Chicago, across Chicago hospitals, our new admissions per 100,000 population is at 7.7. We want to stay less than 10. Cook County overall, which includes actually not just Cook County, but it includes, for the hospitalizations, McHenry County, DuPage County, Lake County, just a little bit above that 10, and that's part of what's keeping the region at high. But the proportion of staffed inpatient beds well below 10% in both of those. So no major signs of concern there, although certainly we're monitoring, and no sign that we would need to do a new mask mandate at this point, the way the numbers are looking. So while we're at high, this is across the Cook County and Health Service area, you can see that the daily hospital admissions on the top there are leveling off. The percent of ICU beds is low, and the percent of ICU beds also low. And so just as a reminder, if you are going to be traveling, whether it's across the U.S., et cetera, anywhere that is yellow or medium risk, we recommend wearing a mask in indoor places. And for places that are high risk, like Chicago, we wear a mask in indoor public places. Get up to date with COVID vaccines. I would avoid traveling to places that are high risk if you're not up to date. And if you do travel to those settings, know that they're high risk. And we'd encourage people who are unvaccinated, not up to date after travel, to be trying to quarantine or take that test. Obviously, we ourselves are at high risk. And so it's just recognizing that when people are traveling, they tend to have a lot more exposure in settings that they don't know of people's vaccination risk, unusual exposures. So the guidance remains the same there. Okay, a lot of you were asking about B4 and B5. So I saw Kristen Korkowski saying, as the numbers are going down, what do we think will happen? Will BA4 and BA5 affect this? And then Gene Brooks was saying he keeps reading about B4 and B5, but it wasn't on the sort of the reporting before. So for both of you, I'm glad you're paying attention. And here we did go ahead and break out both BA4 and BA5. They were previously being included in one of the other subvariants because we are keeping an eye on them. And for people who aren't watching that closely, all every subvariant that we are detecting, every variant that we are detecting here in Chicago, across the Midwest, are all still Omicron. It's just these different subvariants of Omicron. And so for people who have had a COVID infection since approximately January, that's pretty much all been Omicron. And we continue to see these new subvariants emerge, which each one is a little bit more infectious or contagious than the rest, but they're not resulting, as long as people are up to date with vaccine, et cetera, and especially if they've recently, relatively recently had COVID, we're not seeing a ton of reinfection. But you can see here that at the bottom, this BA4, BA5 are each making up between 2 and 3%, and we're watching that growth. Across the country, we've got the two BA2s we've been watching all along, and then 4 and 5. And you can see, it is showing up across the country, nothing really dissimilar here. And to the questions about what do we think will happen. So I think that was Kristen's question just now. So we mapped out here in Chicago how quickly have these different variants shown up. So the faster a subvariant is growing or a new variant is growing, the higher concern we have, because it means it's very infectious, not a lot of prior immunity, et cetera. And so you can see that dark purple here, that's the BA1, the original Omicron surge, December, January. See how quickly this shot up. Just, within 3 weeks of having 1% of BA1, we were on this major increase. And when you see a really fast increase like that, that's what has the potential to really worry us in terms of potentially overwhelming health systems and more of those outcomes. Everything since then, you can see, has been on a much slower trajectory. You can see Delta here, for comparison, in that brown, was a little pokey till about 6-7 weeks, and then we did sort of see that increase. But BA4, BA5 is at the bottom here, the one that we're just about 6 weeks that we've been seeing it at low levels, and no sign of any major increases or concern right now. So I would say, obviously, we continue to monitor it, but nothing about BA4, BA5 right now is making me concerned that it is likely to seed a major surge, but it continues to show us that the virus continues to evolve. And I think we are likely to continue to see that. All right, in terms of cases, someone had asked, how do we look at daily cases? So if you just blow up what's on the dashboard every single day, we do update this. And you can see that over these last couple of weeks, the numbers are coming down. And people were asking about reinfections a fair bit. So about 10% of last week's reported cases in Chicago were reinfections, meaning a second or even a third COVID case. And the great majority of these are people who were initially infected a long time ago. We're not seeing very much at all of people getting a second or a third case if the version that they had was Omicron. But nevertheless, we are seeing that vaccination status and booster status does affect susceptibility even for reinfection here. And so, for example, last week, still about 90% of the cases coming in were first reported cases. About 10% were second cases, and then we had about 25 people with a reported third case in, and it can happen. This is, to me, a really, really interesting chart from our epidemiologists. So this is talking about reinfections. And so that blue line there shows in Chicago what percent of the cases that we were seeing reported in were reinfections, meaning a second, a third case. And it had really been very consistent in this 2 to 3% range for months. And then you can see when Omicron hit, one of the biggest things that we saw was that it could evade infection-related immunity. And so especially people who were not vaccinated and we're trying to count on earlier episodes of COVID to protect them, we saw almost no protection from that. And so now we've gone up to more consistently 9 to 10%. And you can see that gray bar is just what the cases have been. So no matter what the cases have been, one of the concerns of Omicron is just that it does a better job than any prior variant or subvariant at evading that infection-related immunity. Regionally, Everybody, Illinois, Wisconsin, Michigan, all seeing a slight decrease since week 19 or 20, just like Chicago. And Indiana and Iowa are still up, but they're doing so much less testing in the community. This is really more people who are sicker coming to the emergency department in the hospital. The counties around Chicago also have peaked in the 19 to 20 range. So all of this tells us that it's not inconsistent, that it's not just a blip, that yes, we do seem to be starting to get, from a case perspective, on the other side, but numbers are still really high. When we are high, that means mass, that means there's a lot of COVID around. Hospitalizations risen just a little bit since early April, but near historic lows. You go back to January of this year, more than 300 Chicagoans hospitalized with COVID in a single day. Right now, we're averaging just not even 10% of that, so that's good. And where we look at the various forecasts through CDC and others, we're expecting over the next 5 weeks or so, probably, these are models, but that we would expect to see approximately flat COVID hospital admissions. And I never completely, models, you always have to take them with a grain of salt, but these are modelers across the country who look at data, and then the CDC pulls together all of the different models. That looks promising. And as far as deaths, we're averaging 0 to 1 deaths, and we have been since March, the lowest that we've been throughout COVID, averaging fewer than 5 Chicagoans dying from COVID per week, compared to 50, 60 a day at the beginning. So that's good news. And a number of you were asking, what else do you track? And CDPH tracks a lot of other things, of course, internally. I thought I'd just give you a little sense of this. So, for example, we track emergency department encounters. This has been a really important indicator that lets us see across the whole city where folks are coming to the emergency department and then getting diagnosed with COVID. We remain at low level of that. Just 2.2% of emergency department encounters have a COVID diagnosis. In terms of our wastewater, the team there looks to see across the various 11 sites here in Chicago, if over 10 days we're seeing double the rolling average from 2 weeks prior. We're at medium concern there, so still elevated, but nothing very high. And then as far as the risk assessment, there's additional details there, but it has to do with, have we seen a new variant of concern that's increasing at a certain rate? That too remains medium. And then I pulled up skilled nursing facilities here just as an example of some of the higher risk or less vaccinated settings that we monitor. So our skilled nursing facilities, we have a very low barrier for defining an outbreak there. So even within 28 days, nursing homes will stay in outbreak status, extra PPE testing, et cetera. But we've had just 4 new outbreaks across our 78 skilled nursing facilities or nursing homes in the past 7 days, which is low concern, and our sort of ongoing outbreaks, meaning in the last 28 days in that medium concern, and then averaging about 7 cases per outbreak, which is at low concern. So this just gives you a sense of some of the other things we're following when we're making those decisions about when we may need to do additional mitigation. And thanks to all the teams, I've got so many folks, we work in homeless shelters, we work in other congregate settings, we of course do our work with schools, but everything here remains sort of at either low or medium concern. Quick reminder on boosters, because we always get these questions. Everybody over 5 should be getting boosted 5 months after your initial series, and then everyone over 50 or anybody over 12, moderately or severely immunocompromised, should get that second booster. This is straight off the website. We're still concerned that folks have not gotten boosters. Even though, especially with Omicron, boosters really have mattered a lot, including protecting against severe outcomes. So 76% of Chicagoans over 12 have completed their primary vaccine series, but only 42% have had that recommended booster. And I'm most concerned about people over 65, where only 59% of Chicagoans over 65 have had that booster. And that is the group statistically by far most likely to get ill. So if you know anybody who seriously ill, so if you know anybody over 65, please make sure they're up to date with vaccines. Here's what our race ethnicity data looks like, still lagging among Black non-Latinx Chicagoans, but Black non-Latinx Chicagoans are also the most likely to be getting vaccinated for the first time now, which is good to see. Just a quick reminder, if you do catch COVID, nothing has changed on isolation or quarantine, regardless of your vaccination status. If you test positive, including on a home test, test, you need to stay home for 5 days. If your symptoms are resolving or gone by day 5, you can leave your house at that point, but you've got to continue to mask and be careful for days 6 through 10. So nothing has changed there. You should, I hope, have already ordered your 3rd round of free at-home COVID tests from the government, but if you haven't, do that. You get 8 in this 3rd round, so covidtest.gov, put in contact and shipping, and they will send you COVID tests at no charge. They don't ask about insurance, any of that. You can also call 1-800-232-0233 if you don't have internet access. Please get those and use them. These are the ones I use at home. And finally, as always, you can give us a call, 312-746-4835. That our call team has taken more than 500,000 calls in and out related to COVID, and they will help figure out whatever you need help with. Vaccines, boosters, testing, whatever it is, please give us a call. And I know that was a long update, but hopefully we got through a good number of your questions. And now I'm going to end the slideshow, and we will turn to your direct questions for the remainder of the time. Okay. I see Francie Swidler on Facebook. Are you seeing this BA.4/5 variant producing more long COVID symptoms? And besides being more contagious, how is this variant different? Yeah, good question. So we are not at this point seeing this subvariant producing more or different long COVID symptoms, but literally, we've only been following BA.4/5 for a couple of weeks. And so that's not really enough time to be able to fully address that question. However, we are generally seeing, there's some big studies that are going on nationally to really understand more about long COVID, and I think that that's important. You ask, besides being more contagious, how is this subvariant different? Based on what I've read now, really, it's just that it is more contagious. We're not seeing that it's making people more severely ill or showing up in different ways, but it's just another subvariant of Omicron. Okay, so we got a bunch of questions here, so let me try to get some of these together. A couple people are asking about testing. Alexandria Deanne on Facebook says, I tested positive for COVID with a PCR test 3 weeks ago, but I never tested positive on an at-home test. I now have an ongoing cough. How do I know when I'm no longer contagious, and how long could this last? And if I'm exposed again, do I need to quarantine because of my cough? All right, those are good questions. Let's sort of take it one by one here. So if you tested positive 3 weeks ago, regardless of whether it was on an at-home test or a PCR test, really, we don't see people continue to be contagious past a couple of weeks, really. So if it's been 3 weeks, even regardless of whether you ever had a positive test, that cough is not likely for you to still be infectious. Cough tends to always be the lingering result that we see after any viral infection. Just in my regular role as a primary care doctor, one of the most common things I see after somebody has a flu or RSV or just any random cold or COVID, the cough tends to be what lingers. That doesn't mean that you're still infectious. It's that you've had a lot of inflammation in your airways, and the cough is your body's attempt to sort of continue to expel any potential invader and allow it to calm down. So I would not consider you contagious. And frankly, if you never had a positive at-home test and you're still not having a positive at-home test, almost certainly your level of virus was pretty low, even at baseline. And so your risk of spreading would be low. So if it's been 3 weeks and all you have is a lingering cough, I don't think that you need to, I would keep wearing the mask, which of course we recommend universally indoors anyway right now. And if you're exposed again, do you need to quarantine because of your cough? I would say no. Those at-home tests, if you're contagious, if they're positive, we treat them as a plus, but otherwise, if you've just recently had COVID, we also don't see a lot of reinfection, especially in those first few weeks while everything is remaining Omicron. So I think you're good. Obviously, if coughs really persist, I would recommend seeing your doctor just to make sure there isn't something else going on. But generally speaking, often coughs will linger even up to a month and then slowly resolve. All right, I see Aaron Hoffman on Facebook. Should we report positive at-home tests to our primary care provider or elsewhere? Yeah, I mentioned this briefly. I would like you to report a positive at-home test, mostly so your doctor's office has awareness, but also in case you're at higher risk for a severe outcome, and they can prescribe you or recommend some of the medications. There's not a separate reporting mechanism at this point. We don't need to know about every test in a monitoring kind of way. We account for sort of the known underreporting. There's been underreporting at all points. So thank you for that. But yes, let your primary care provider know. They are able to report it in if they want to. All right, Namrata Bada on Facebook says, PCR remains positive for 90 days after you've had COVID. What should be the testing strategy? Okay, PCR is very unusual for it to remain positive, especially for 90 days. It can remain positive for 10 days, 20 days. But in most cases, it doesn't stay positive that long, and 90 days would be the very outside edge that we're seeing. What I recommend in terms of testing is really in those 90 days, especially while everything remains the same variant, you're extremely unlikely to be reinfected with COVID during that time period. The main recommendation we give around PCR actually is related to international travel. Like if I were to test, I still have not tested positive actually at this point, but if I tested positive on a home test, I would not go and sort of reconfirm that with a PCR. These home tests are generally good, and especially if they're positive, they're good. If you've got symptoms or you've had an exposure and they're positive, like you have COVID, treat it as a positive, stay home for the 5 days. But I would go get a PCR if I thought I might be traveling internationally, or I needed to, in some way show a negative test for something that was coming up, because that way you have a formally recorded positive test in case you are one of the people that the PCR stays positive in. A positive PCR does not mean that you are still contagious. It's very, very sensitive. So it means you've had COVID, you either have it now or it's still picking up traces. So testing strategy, once you've been positive, you have COVID. And for those 10 days, while symptoms resolve, you're sort of getting over that COVID. And then after that, you don't need to be, you may be in a setting that's requiring routine testing for some reason, in which case I would get that PCR just to avoid trouble. But otherwise, if you were to get new symptoms, sure, you can take an at-home test or a PCR, but you don't need to be additional testing. Faith State from Facebook. Where are masks required now? Are they required in pharmacies? So there remain some settings, primarily healthcare settings, where masks are required, but they are not required at sort of in the general setting at this point. And a pharmacy, there may be pharmacies that are deciding to require it, but there is not a City of Chicago requirement in pharmacies to be masked, yeah, but we obviously strongly encourage it. I definitely put my mask on whenever I'm going inside, and would especially do so in a pharmacy where there may be people, who are picking up medications, et cetera. But to my knowledge, I know the City of Chicago has not required it, and I don't know of chains that are universally requiring it at this point. Ina F. Miller on Facebook. Can a senior citizen go to the eye doctor at this time with boosters? Yes. I really want to encourage everybody to be getting their medical care. We are doing fine from a COVID perspective, especially if you're up to date with your vaccines and your boosters. Settings like doctor's offices, eye doctors, healthcare setting places, they are requiring masking in those settings still, recognizing that people who may be older, have underlying conditions are coming. And so, obviously I don't know what the condition is or why you're going, but I don't want folks putting off routine appointments, certainly not urgent appointments. We've seen with COVID increases in bad outcomes, deaths even, related to things like heart disease and diabetes, where folks, were not seeing, getting their regular medical care, and we want to make sure you are. So yes, I would go to the eye doctor. I would make sure you're boosted, for sure, to do that. I'm glad you're asked about that, and I would wear a mask, but yes, please do get your routine care. Oh, this is an interesting question. Patricia Dyer Walsh on Facebook. I'm scheduled to have oral surgery last month. My oral surgeon informed me he has contracted COVID on 3 separate occasions. Do you think I should consider another surgeon? I've been fully vaccinated and received 1 booster shot as well. It's interesting. So, you know, it is rare for us to be seeing people having COVID that many times, but to me, actually, because the surgeon, it's interesting to me that he is sharing that with you. To me, that doesn't necessarily suggest a concern with him. I presume he is up to date and boosted. That would actually be my primary question. It tells me he's also probably being careful with testing around COVID. I would not change to another surgeon based on that information. I'm glad you're vaccinated and up to date, and I think that's really important. Obviously, an oral surgeon who is up close, needs to be doing the masking, and definitely is. But I would say, as long as that surgeon himself is up to date and obviously is masking during the time that he's doing the procedure, that would not be a need to switch it up. But that's an interesting question. Teresa Diane Colismo is asking, should beauty shops be doing the mask mandate? So there's not, again, a city of Chicago requirement for everybody to do the mask mandate. We would put that in place, just to be clear, if we started seeing our hospitals getting stretched, more concern there. But we are very much in support of settings that choose to have masks on, in especially settings where there's close contact. Our theater community, for the most part, I've been going to the theater a lot these last few weeks. They continue to require masks. I think that's great. There's a lot of older people who go to the theater. It just takes everybody's anxiety down, lets them be fully open. Places like beauty salons where there also is extended, often closer contact. I certainly would wear my mask if I was getting a haircut or anything else, and I would probably ask the person who was working on me to put a mask on. And if there are settings that decide, even while we're at this higher risk, right? Like, that's the point. When we're at higher risk in Chicago, there's a lot more COVID. The masks, remember, you can spread COVID for 2 days before you have symptoms. Masks are especially about protecting others, although they also help with yourself. Vaccines, especially about protecting yourself, though they also help with others. So I've been pleased. I take the L to work every day. Almost everybody's wearing a mask in that setting. I like that. It tells me that Chicagoans care about others and not just themselves. Okay, Lori Selby Schwegel from Facebook. What is the current recommended timeline or quarantine period for those who live with someone who tests positive? And there's sort of a long thing here, so let me read it. My husband became symptomatic May 30, but he had a lot of negative tests, but he stayed in the basement for a week. Now, 8 days later, symptoms are gone, but then he tested positive. I've had limited contact and no symptoms. I would think I've gotten sick by now. Should we wait in a certain period before having guests in our home? Okay, so let's review this at the high level, and then we'll talk about just quickly the specific situation. So first of all, there's a difference between isolation and quarantine. Isolation is somebody has tested positive for COVID, they're having symptoms of COVID, or it sounds like in your husband's case, maybe his level was really low, but maybe he'd had an exposure, he was sick. Appropriately, he's isolating. He's like, this is probably COVID. Maybe he's waiting for a PCR test, whatever it is. He's isolated. He needs to isolate, for those 5 days, and then continue to mask for 10 days. I would say, in terms of quarantine, remember, is not somebody who's tested positive, but someone who's had an exposure to someone who has. With Omicron, we are seeing a lot more breakthrough cases, but the timing is the same. And the question is whether you and the other people in your household are up to date with your vaccines. So if you have had if you've had 3 vaccines and you're over the age of 5, or you've had 4 vaccines and you're over the age of 50, and you're up to date, you don't need to quarantine just based on, your spouse or somebody else being positive. So if he's just tested positive for the first time, that's interesting. I don't know if that was home test, et cetera. But in terms of having guests in the home, my recommendation there would be, I would basically, from whenever anybody is testing positive or having symptoms, I would just give it 10 days from either of those to, having guests in your home, presumably have masks off, et cetera. I would recommend just waiting that 10 days just because you don't want to inadvertently be spreading it. But I don't think you need to be staying home from work, et cetera. And that is always going to be a little bit of a sort of judgment call back and forth there. I know it can be hard when people get negative tests on the at home, and I'm glad. It sounds like your husband did just the right thing. If he knew he was high risk for some reason, exposed, and he had symptoms, especially when the viral level is low, that at-home test can stay negative. But while that at-home test is low, he's also very unlikely to actually spread COVID through that time, right? That's the difference. And so, yeah, I would just to be, I think it's unlikely you'll probably get sick at this point. If you haven't, you're up to date. You don't need to quarantine in terms of staying home, but just kind of abundance of caution. Personally, I would wait at least 10 days to invite people over into my home. All right, Carlos Ronica from Facebook, taking the big picture view here. Can you elaborate as to how far are we on the, quote, other side of the pandemic? What percentage are we to seeing the actual end of the pandemic and possibly taking our masks off? All right, good question, Carlos. So let me tell you how I think about this. Right now, COVID is behaving very, very differently than it did in early 2020 or even early 2021. And that's good. That is primarily because of the vaccines, as well as we have treatments available now, actually good treatments that if people who are higher risk get COVID and they take the treatments early, about 90% in terms of keeping people out of the hospital. So when we have so little serious infection, if COVID had shown up back in March of 2020 like it's showing up now, we never would have actually needed to do sort of the lockdowns and all of that. But we had to at that point, obviously. To me, it's obvious when you've had, it's the second leading cause of death in the city. We've now had more than 7,500 deaths and major risk for overwhelming the health system. And as soon as you do that, we've seen that in prior outbreaks, Ebola, et cetera. We saw that in New York. We've seen that in Italy. Then your risk of death, not just from COVID, but so many other things, goes up so high if we can't actually take care of people that you're sort of looking at those risks together. So right now, we are at a point where if we never saw another variant of COVID emerge, I think we'd be pretty good from here on out. I think it's likely, though, given that we continue to travel as a world, we continue to see transmission. I don't think we're done seeing new variants, and so that's sort of the big question mark. But in terms of when are we, quote, possibly taking our masks off? So one of the reasons that we've worked hard, and I'm glad that the CDC is playing this national role that they were less able to do early in COVID, setting these low, medium, and high risks for different counties and updating it every week, that is really meant to help you on an individual level know when that mask is more important and when it's less important. So when we were at low, and I expect we'll get back to low again, I was not wearing a mask, even indoors. There may be people who choose to, right, if you're at higher risk immunocompromised, but generally when we're low, there's not a lot of COVID around, not threatening the health system at all. When we get to medium, that's when I start putting the mask on indoors, especially if I'm in settings where I don't know everybody's vaccine status. And right now, while we're at high, that's the period I'm being extra careful, right? Even at work, even with a few people in a meeting, we're putting our masks on. But I think the idea is that this is probably going to continue to ebb and flow a little bit. And as we continue to learn more about long COVID, as we continue to see variants, I am very hopeful that we're not going to see it upend our lives like it has these last couple of years. That I, my dearest hope, in the absence of some crazy new variant that the vaccines are not effective against, or that is showing up really differently, I hope we never are going to need to do any of those lockdowns and shutdowns and capacity limits and all of that again. But masks are a tool when the level is higher that can help protect others, keep that risk down, and keep us open. So believe me, nobody wants COVID to quote unquote be over, like more than I do. But I think it probably is what we call endemic, which means it's just going to be here with us at some level. And maybe it'll be kind of like flu, where we're sort of, we get into a seasonal pattern and there may be an annual vaccination. But I don't think, in the absence of a new variant of major concern, I'm not seeing anything suggesting the major disruption to our lives. People can be at work, people can be at school, even when we're at this higher level, because we've got vaccines and treatments. And next fall, I do think it's likely that there will be a vaccine, sort of an updated version of the vaccine that's been altered a little bit, bivalent vaccine, to pull in some of the changes that we've seen with the variants. My guess is that will be a universal recommendation to get that kind of updated vaccine. And is that going to be an annual thing like the flu shot is? Every year we make a new flu shot based on the variants or the strains of flu that circulate. I don't know, but in the short term, we might. Overall, thank goodness we have these tools, and I hope people continue to use them so that COVID doesn't need to be part of your sort of day-to-day thinking as much. And I want people out and about, and we're thinking a lot about people's mental health and reconnecting. But when levels are high, just to be extra careful with masks, with testing, with people who are at higher risk for severe illness. So I hope that helps as we kind of think about this. All right. We're just about at time. Let me hit a couple more of these real quick, though. Curtis McDowell on Facebook is asking about digital vaccine cards. Where they remind ink-written dates. He says, I called the CDC to see if my card number was in their data, but the channel they answered didn't have it and sends me to the facility where I got it. How do we do this? How do we trust the card? Okay, so first of all, the CDC actually never receives anybody's individual information related to their vaccine status or anything else. The CDC's job is to understand, at the national level, what's happening with patterns. Obviously, we are careful around privacy, and so the CDC actually cannot answer whether or not you, Curtis McDowell, have had a vaccine. That's not really their role. In Illinois, though, we have a electronic registry called VaxVerify, and there, your information is electronically stored. When you were vaccinated, your provider gave you a written card, but also was required to report that in. And there's a lot of privacy stuff around that, of course. But you can look online. If you go to the Chicago Department of Public Health website, there's some information on there, sort of, if I lost my card, but even if you didn't lose your card and you want to get the electronic, there's some links there and ways you can request it. And know that, yes, there is a record, but it's not the CDC that has it. So thanks for that, and let us know if you've got additional questions after you try that. Here's just a quick follow-up question from Lori about that was the longer conversation, the quarantine and isolation. She's saying, no guess for 10 days from the onset of symptoms or 10 days from the positive test. I would do it from the positive test, honestly. I know it's sort of an unusual situation, but if you've got a positive test, abundance of caution, I would recommend from whenever the last positive test or sort of new symptoms was to treat that. If you're having folks over, do it outside, right? That would be one way to limit that risk, depending what that time frame is. But inside the home, just to be careful, that would, especially if anybody's higher risk for severe outcomes, that would be my recommendation. Hernanda Christina on Facebook, what are the guidelines for children under 5? Can children have long COVID? Once they're able to get vaccinated, would it help them recover? And what new healthcare updates are there for this age group? Okay, so I'm not sure if you were watching a little bit earlier when I went over the potential timeline. There is not yet a vaccine that's authorized for children under 5, but it's looking likely that may happen a little bit later this month, at which point we'll wait for the FDA and the CDC, but we would strongly recommend that children under 5 get those vaccines. Both Moderna and Pfizer have put forward applications to the federal government, and my understanding is that the Moderna is a two-dose vaccine and the Pfizer is actually a 3-dose vaccine. But again, we'll have some details on this after the meeting on the 15th. Can children have long COVID? They definitely can have long COVID. And to the question of once they're able to get vaccinated, would it help them recover? So we had this interesting situation that nobody's really expecting. When the adult vaccines came out, there were people who had had long COVID who, when they got vaccinated, it actually seems to have cleared up their long COVID symptoms. You know, we know that this has something to do with your immune system and it responding in unusual ways. So this is still very much under study, but we don't use vaccine to treat, we use vaccine to prevent. And so you want to get your child the COVID vaccine before they get COVID. Yes, it can help protect them from COVID, from long COVID, and from severe outcomes from COVID. And, you know, I can tell you that my nieces and nephews who are under the age of 5 will be getting vaccinated right away as soon as a vaccine is available. So I hope that helps. And we will be talking about this quite a bit more, of course, over this month. As we get the data and the external experts that advise the federal government weigh in. Okay, I think we are just about at. I mean, we are at time here. Lots of questions today. I appreciate people's good stuff. Quickly to the question, is CDPH still driving around to assist homeless people find care? Yes. We work with others. We've been doing a lot of outreach. We fund outreach on the CTA in encampments, and we are very much still focused on that. Amanda DW on Facebook, any update on the hepatitis cases in kids? Nothing notable. We have continued to see an occasional case, nothing different in terms of risk factors, and it remains extremely rare. So nothing different in terms of guidance there. We'll let you know if anything more. All right, and as the last question here, I'm going to take Adair Small on Facebook regarding the infant formula shortage. Says, as a retired nurse, I find it difficult to understand the objection to old-fashioned evaporated milk, water, corn syrup formula. I and many others grew up on this with vitamins without being malnourished. All I can think of is the concern about sterilization of the formula. It's harder to get glass baby bottles and steriling posts. Can I comment on that? Yeah, thanks for that. So, the biggest concern, you know, I'm a pediatrician, is that I personally have seen in my practice people who are trying to make things to feed young babies and making mistakes with it or wanting to be organic or whatever the case may be. And we have seen both the contamination, as you know, people are not that good at some of the sterilizing and whatnot that can come there. But also, frankly, there are a lot of vitamins and nutrients and things that are in baby formula. And given that, you know, young children who are not nursing really are getting almost, you know, up to 6 months or so, and you know, they're getting the really all, and then beyond that, most of their nutrition from the formulas. We've just seen things go badly when people, sometimes with the very best of intentions, try to make their own formula to feed their babies. Of course, where people are breastfeeding, it's great, that's the best, but if they're not, I continue to feel extremely strongly and very strong recommendations that we want you to use one of the formulas that has been made for that purpose. So, you know, as a nurse, thank you for, you know, back in the day helping folks do that. But, you know, I took care of a baby who was admitted to the hospital with severe malnutrition. This is back a number of years ago, where a family was trying to make their own formula and just didn't really understand, and were trying to be very, quote, natural in a way that was really dangerous to the baby. And so whether it's for potential infection, but more to the point, people trying to mix things up, that's why we recommend it. And I know for those of you with the really young children, it's been hard. The folks in the WIC clinics at CDPH have been working hard to make sure people can get formula, and please don't hoard it. Please make sure that as the supply is now picking up again, starting to, I know it's been another challenge on top of everything else. So thank you for that. And thank you everybody for your good questions. We, at this point, are not planning to do a Facebook next week. I am actually planning to take a vacation, which is, it's been a long time since I've had a full vacation. And then the following week, I think depending a little bit what's happening with the child vaccination, et cetera, we may do something on Thursday, June 23rd, to be determined a little bit. But so nothing planned for next week. We'll let you know about the details of the week after. And in the meantime, I want to wish you all a happy Pride Month. And I hope it was reassuring to you to see the improvements lightly in some of these COVID numbers, but there's still a lot of COVID out there. So while we remain in high, please do be extra careful just with those masks and get up to date with vaccines and boosters. It makes a difference. And I appreciate all of your attention and thoughtful questions. Thanks. Bye-bye.